In our lives, we have so many distractions, and an asthma attack on top of all of that shouldn't be something that we have to worry about. What if you had a super magic power where you could actually predict an asthma attack before it happened? Well, that would be pretty awesome, and VitalFlo is doing something that might just work. Let's invite Luke Marshall out to the stage.
Nothing is scarier than being unable to breathe. But sadly, that's a reality for 25 million Americans who suffer from active asthma. These patients end up in the hospital due to asthma at a rate of 1.6 million visits to the ER every year. And today, 10 people will die from asthma in the US. And all of these trends have been rising since the early 1980s. And why is that? We have medication that works. We have doctors that know how to treat this disease. How on earth is this something that is getting worse over time? It's because asthma care is broken by bad data. Though we have drugs that work, complying with those medications is a challenge. Lung function data and home monitoring of our lung health is currently done by an analog device that hasn't changed since the 1970s and recorded with pen and paper. Clinical quality data is only available to patients once, maybe twice per year with a respiratory specialist. And we don't have a good way of tracking the triggers that can set off an asthma attack based on environmental conditions. And all this leads to anxiety and confusion for patients who just don't know what to expect. We founded VitalFlo to solve this problem and to build a future without asthma attacks. And it all starts with our mobile spirometer. This is a handheld medical device that you blow into, exhale forcefully into. It syncs automatically with your phone over Bluetooth and provides clinical quality data put up against the clinical standard device in the lab. We've made it ultra portable so that patients can track their lung health on a daily basis. And because it syncs with your smartphone and we know where you are, we can track those environmental triggers that might be causing your asthma attack today. We help patients stay on track with timely notifications of weather events that might cause an asthma attack, reminders to stay on track of your inhaler use, and reminders to stay on track with recording your lung health. And this is all part of our respiratory monitoring system. Starting with daily use of the device and the app, the data is automatically synced with our cloud analytics platform that can flag risk events, signals that you might be about to have an asthma attack, and push that directly to your doctor. That enables your doctor to make timely recommendations, preventing you from ending up in the ER. As I said, there's 25 million asthmatics in the US, and we're focused on the 5 million of those asthmatics who suffer from persistent severe asthma. So this means having asthma symptoms on a daily basis and taking medication on a daily basis, or at least supposed to take medication on a daily basis. And we're starting with the beachhead market of the 2 million pediatric patients that suffer from persistent severe asthma. Now, with 5 million patients and charging $230 per year through combined sales of our mobile device, as well as a $15 per month monitoring fee, we have a very sizable market, over $1 billion. And this is a model that payers are used to seeing in diabetes and cardiac monitoring. We have an award-winning team with 20 years of scale-up manufacturing experience, 10 years of commercialization experience, and a rock star biomedical engineer with hardware and machine learning expertise. And this team has already won Now, thanks to the launch place, over $200,000 in non-dilutive award funding. And we've taken that money and put it to work achieving our proof of concept and big milestones, including executing our exclusive license, patent license from NC State University, where the hardware was developed, designing that device for scale-up manufacturing, completing our mobile app platform, as well as completing a 90-patient clinical study where we showed through 160 patient interactions that our device stood up to the lab standard. And it's in that clinical study that we also learned that patients love the VitalFlo, and they were disappointed when they couldn't take it home. And through the Innovators Program, we had conversations with pediatricians and primary care physicians, and they told us that they have many patients that they would love to give this device to. And that love from pediatric offices has resulted in 5 pilot commitments from regional players. So we're VitalFlo, and we're helping asthma patients know what to expect so that they can breathe easy. If you're an asthma patient and would like to participate in one of our pilot programs, or your child is an asthma patient who would like to participate in one of our pilot programs, you think your doctor should be talking to us, please come find me in the cocktail hour. Thanks.